Good morning or good evening or wherever you are in the world. Hello, nurses and friends. This is the second series of my NCLEX test taking strategies, which is the second one out of 50. Also, a disclaimer, by the way, this test taking strategies, I'm not saying that following this 50 strategies will make you pass the NCLEX, but it will help you, it will guide you, but nothing beats your review and investigate if there are any information that you feel that you're not comfortable about it, or you need to be informed more. So don't hesitate to investigate and read a lot, so because that will help you in the future. Moving forward, so the second strategy would be don't do nothing. Okay, and a sample for this one would be this multiple choice item. A client is in the first hour of her recovery after a vaginal delivery. During an assessment, the lochia is moderate, bright red, and trickling from the vagina. The nurse locates the fundus of the umbilicus. It is firm and midline with no palpable bladder. The client's vital signs remain at their baseline, and based on this information, the nurse would implement which of the following actions. Number one would be increase the IV rate. Now, this option is, it needs a doctor's order in the first place, and it's irrelevant to the mentioned situation, right? Number two, we check the admission and hematocrit and hemoglobin levels. That's still not. It basically gives you a baseline of admission labs, but it will not give you. It will not solve the problem. Number three, that will go back. Number four, document the findings as normal. Well, that will be a question mark as well. Now let's go. Read the proper rationale for this particular test item. So, at any point in the let's do this one by one. At any point in the postpartum period, the locus should be dark in color rather than bright red. As we all know, bright red means, what does it mean? It means there's an active bleeding, right? So, because if it's an old one, then it will be dark red, or if there's blood clots, it might be brown or it might be black. That which means it's an old bleeding, right? And it should be postpartum. It should not be trickling or running from the vagina. Now the volume should not be great enough to trickle or run from the vagina. The information provided states that the fundus is firm and midline at the umbilicals, which are expected outcomes, right? At the postpartum, that means, which also means the no palpable bladder. That means the bladder is not it's not a full bladder. This finding would indicate that the bleeding is not coming from the uterus or the uterine atony. Increasing the IV fluid will not be affecting the patient as well. And rechecking the hematocrit will only provide background information but will not rather solve the situation. So the correct answer for this one would be reporting the findings to the healthcare provider or the doctor, right? Because this is now normal outcome. Now the number four is not a correct answer because, well, obviously it's not normal. On the other hand, this is another multiple choice, right? But this is on the other aspect of it, because the answer is doing nothing, right? So the multiple choice says the charge nurse is an extended care facility, notes an elderly male resident holding hands with an elderly female resident. Which intervention should the charge nurse implement? Number one option, do nothing, because this is a natural human need. Number two option, notify the family of the residents about the situation, which is highly not practical. Number four, separate the residents for all activities. I mean, this is not normal. No? Number four, call a care plan meeting with other staff members. Obviously, I did say that the strategy is don't do nothing, but on this particular multiple choice, we do nothing because, well, touching is a natural human need. Also, even if it's two men, two women, with the current source, well, the current flow of our NCLEX, we should respect each other and express tolerance and respect. So even if it's a man to man or female to female, we should not we should tolerate and respect each other. That's about it. Also, don't forget to like and subscribe to my YouTube as well as my TikTok as well as my Facebook. You can request with Alfred Lai as the name to request your friend, request friend status, and also have a nice day. Bye bye.